Hi, Julie. Welcome. Thank you so much for taking the time to talk with us today, all about who you are, what you do, and how you do it. I would love to dive into the conversation if that feels good for you today.
Yeah, that feels wonderful. And thank you so much, Natalie, for inviting me. It's such a pleasure as a podcast host, it's so fun to also be on other people's podcasts as a guest. So thank you.
Thank you so much. I'm really excited to have this conversation with you because I would love to talk about the transition from pharmacy to health coach. Like what that's a big leap to go from a medical background into more of a coaching background. Was there an experience in your life that shifted how you saw health and healing?
Yeah, so I always share there's two things that happen in my life in parallel that influence me moving from pharmacy only kind of practice to incorporating health coaching tools. So the first element of that was when I started as a pharmacist, I was working in hospitals and an ambulatory clinic with very sick patients, terminally ill patients who were on dialysis. And for those of listeners who don't know what it is, basically kidneys aren't working and you're hooked up to a machine where the machine is basically filtering your blood and doing what your kidneys are supposed to do. So very ill. And 50% of this population had very severe diabetes. And what I realized was no matter how much insulin or medication for diabetes we would give to them, if they didn't implement the lifestyle habits changes that were recommended to them, the medication wasn't going to be enough to support them. It was going to keep them out of dangers and having lethal high blood sugar levels, but it wasn't really going to help reestablish their health. So that's already there. I was confronted as a pharmacist, seeing that, okay, medication has limitations. And as a healthcare professional, it's a bit frustrating to know that the tools that you've been trained in can't fully help somebody in terms of their health and their well-being. They're useful, but they're like not the only option. So this experience and frustration, I would say, led me to become more curious about preventative medicine, preventative health. What can we do to not actually wait until our kidneys are no longer functioning, but what can we do before to still help maintain and encourage and take care of our bodies, which isn't so talked about in our current healthcare system. It's a lot about treatment. The second thing that I would say influenced my desire to learn more about preventative medicine and holistic health was that at the age 24, I did just a routine blood check. And what came out was high cholesterol. So nothing too serious. My doctor was like, it's not alarming, but you probably would want to change some of your habits if you don't want to maybe eventually go on medication. And to give you context, I'm 24 years old, and the idea of taking medication was just ridiculous for me. I'm like, no, I'm not going to be on this medication for like life or cholesterol, which is something that is very proven that your lifestyle habits can have an effect on it. And that was a little bit of the wake up call to look at my own habits because I was eating like very processed diet. I was not working out, and yeah, just overall not really taking care of myself. And slowly I incorporated different changes, went down the wellness rabbit hole that I think many of us go down when we're like first get interested in the topic. And slowly, not only did my like blood tests, let's say, normalize, but also I had more energy. Like the acne that I was taking birth control pill for and like a bunch of topicals, this was really clearing up. My eczema cleared up. I was no longer having heartburn, which occasionally I was taking antacids for. And this is where what I realized anyway, that, oh, wow, I was actually not feeling so well. I was actually quite, quote unquote, sick. And I think I only realized that after once I was able to compare that to how much better I was feeling. So that experience in itself led me to just reaffirm or confirm what I already knew, that lifestyle habit was very important, but I actually sought for myself. And because I'm an eternal learner, I went, let me go study holistic nutrition. And as I was learning about it, for me, just sharing it online about what I was getting curious about, what were my aha moments, led me to build a little community of people interested in what I was sharing. And eventually some people are like, hey, like, I know that you were able to achieve certain results with your own health. And I know you're studying this. Can you help me with my own health? So it was never really the intention of becoming a health coach or making like a career out of this. It was more just for my own interest and curiosity. But like, you know what? Why not? like that part, that healthcare professional in me that wants to help support people with their well-being. I was thrilled about the idea of other people want help with this. Let me see where this goes. So I would say that's like the two things that led me to incorporate health coaching in my toolkit as a healthcare professional.
Okay, there's so much in there. I'm so excited to dive in. It's always scary for anyone to have a doctor tell them like you're going to have to take this medication for life. That is definitely a moment to be like, okay, what do I want to do here? I have two choices, either take care of myself or be stuck to this medication. I had that moment in my life. I got diagnosed with ulcerative colitis at the age of I think it was 32. And the doctor said the same thing to me. And I was like, okay, here I go. I'm going down the rabbit hole of self-healing to make sure that I don't have to stay on medication my whole life. I think that's incredible. And it's so brave to seek that for yourself and to make sure that you're taking care of yourself just for your own being. And then to do it online and have people witness this change, this you creating a whole new way of being in the public eye and creating a community and helping to serve other people while you're learning and while you're adapting. That's absolutely incredible. Wow. And so,
Thank you.
yeah. And so is this what kind of changed the protocol of helping women outside of your community to more moving into the healthcare providers and guiding them in this type of way?
Yeah. So perhaps to give a little bit of context to your listeners. So I practice as a health coach. I had a private one-on-one practice for 6 years, and it was such a rewarding practice. I loved it. I loved seeing the transformation, not only just with the individual, the person in front of me, but also the ripple effect it had on their family and how, let's say a client would tell me, yeah, like my son's now telling me, I want to be like healthy like mommy. And like for me, it's so precious. And being able to see transformation with their relationship with food, with their body, and yes, there's also the reducing their needed medication, because that was one of the things I was specializing in, is helping people reduce their needed medication through lifestyle habits. So obviously seeing all the tangible effects of normalizing their blood test, reducing medication with obviously the collaboration with their physician, but also just the whole, I would say, yeah, relationship with self, which I mentioned earlier. And so that was such a beautiful practice. I loved it. And also I I saw a common theme with a lot of my clients, which was like, oh, it's so cool that you're a healthcare professional and you talk about preventative medicine or integrative health. And I wish more healthcare professionals would talk about this. And so I found it was interesting because I did know a couple of other healthcare professionals who were interested in integrative health, preventative medicine, but there were still obviously like a lot of other healthcare professionals that maybe I don't know, I wouldn't say necessarily close off to the idea, but a little bit reticent about talking more about that. And for me, the idea of one of my mission is to help contribute to a healthcare system where both the public and healthcare professionals are thriving. And for me, the idea of if I want to help share more on a message of preventative health and integrative medicine, I can't, I could continue doing it on one-on-one basis, but I do want to be able to have a bigger impact, a bigger reach. So I'm sharing this because one of my mentors have shared that in order to create the kind of impact that I wanted, I would have to reach out to the leaders and who would then be able to influence their communities. And when I'm thinking about my particular mission, the leaders in the healthcare space, the wellness space, or one of the leaders, not the only leaders, but one of the leaders are healthcare professionals. And for me, being able to share more wellness tools to not only like on a cognitive level for them to understand, but actually apply in their own lives, I have seen in my own practice that when healthcare professional, let's say in my one-on-one practice, I had a few like physician or nurses join my program and they are doing it just for themselves, right? And I saw the ripple effects it had on their own practice. So let's say one physician, she started learning more about like meditation and lowering the nervous system regulation, etc. And to share that, yeah, now that when I get a patient who's coming in for like high anxiety or depression, like obviously, yes, they'll evaluate if there's a need for medication. But then she said, I'm now more talking about nervous system regulation, somatic, meditation, etc. And she can now share that, talk about those tools because she's experienced the benefits for herself. And I think it's much more powerful when you actually experience it yourself versus just saying, yeah, eat more fiber, eat more vegetables, kind of those generic type of recommendations versus like when you start living it and you felt the power and the benefit of these tools. So coming back to your question and what my mentor told me, if I wanted to create the kind of impact that I see as possible, like I have to reach also the leaders and move away from that one-on-one practice, which again was super rewarding. But in the big vision that I have, I don't want to be doing it alone. So let me help the other leaders and who can then influence their community.
What a brilliant vision. It's like a sneaky way to get into the medical system, integrative science.
As you can imagine, healthcare professionals, not like when we're talking about these kinds of tools, I think it's just more welcomed when it comes to another healthcare professional. Because obviously, I know a lot of healthcare professionals who are very open-minded and they're like, we joke like, yeah, we're like the closeted spiritual witches. Okay, let's be public about it. But there's that group who's like super open to a bunch of things and don't blink an eye when you ask them about their astrology signs. But then there's like another group that's a little bit more reticent. So having another healthcare professional share all of these different tools that are actually very science-based, and then we're able to share all the science behind the breathwork, meditation, etc. Definitely it's more welcomed when it comes from, let's say, one of their peers who actually also understand the challenges that they face in their day-to-day life.
Yeah, I was going to say that in the medical field, of course, medicine is fact, right? And so if there's no fact proven, then it's hard to integrate. But with meditation, all these alternative medicines, there is fact. And so it might be easier to bring it in if it's now just becomes an embodied practice that they can speak of and move it into the system with all of the fact behind them. Great approach. I absolutely love it. And so it answers my question of why is caring for caregivers such an essential part of the health conversation? And almost what do you believe, like, why has it been overlooked for so long? Why haven't we taken this approach with healthcare facilitators or practitioners?
Yeah, there are many ways this conversation can go, but maybe what I'll start off with is in terms of why it's essential. One of my beliefs is that the quality of our healthcare system and the quality of the care we provide to the population depends on the well-being of the people who work inside the system. And as you can imagine, when the healthcare professionals are exhausted, depleted, burnt out, it's the quality of the care is going to suffer. And I know we connected over this topic of medical gaslighting. And personally, I believe that it's very rare. And I want to hope that no one wakes up in the morning being like, I'm going to gaslight someone today. I really hope that doesn't exist. But it's when we are exhausted, when we don't have even time to go to the bathroom and basically the working conditions of our current healthcare system. I do believe it makes it very hard to want to be compassionate.
I just want to add, sorry, and also because it's proven, right? The methods that they're using are proven, so they go to them. I think that is an important part of it. It's if we're not, sorry, I didn't want to cut you off.
No, it's fine.
I did. But I think that's a big thing. If you know that prescribing a medication is always going to help your patient, then of course you're always going to go to that if you have no other sources to help or know of any other.
Exactly. And that's what you mentioned also, the fact of evidence-based is we are like from an ethical point of view, it's like we have to recommend things that are proven according to the science. But also we're going on a tangent here, but also like to know that sometimes there is actually a lot of proof behind these like other methods, but we're just not taught that in school, and we don't necessarily do the research after we graduate from school. So in our heads, like there's no data behind it, I can't recommend it. So yeah. So coming back to in a way, just find it. It's good that you mentioned that a little caveat about medical gas. There's many things that contribute to medical gaslighting, but I guess the point I want to make is when we're tired and just don't have time to care for ourselves, it's harder to want to be compassionate and be patient with someone else and listen to their point of view. For me, the idea of when we take care of our healthcare professionals, not only is it good for them, which is important, but also it's good for the system and the patients, because aside from also proper bedside manners, but also an attentive ear, it's when we're tired, we're bound just to make more mistakes, which in healthcare can have a very devastating consequence on the patient. So that's one of the things that I would say is like why we want to care for caregivers is because if we want to care for the population, we have to take care of them or give them tools, right? You also asked like, why is it overlooked? So that's again, like another question that can bring us to so many different paths. But one of the things is I would say the culture of healthcare and even just beginning in like the school years, like university, it's almost like drilled in us of, I won't say like self-sacrificing, overriding our own needs in order to care for the person who's in front of us. Like they are a priority. We take care of them first. And there's also a culture of pushing through, of hustling, of also not showing weakness and flaws. It's basically very patriarchal, the kind of system. And also there's like certain expectations that society has of healthcare professionals of almost like during the COVID time, I don't know if you recall, like it's portraying healthcare professionals as superheroes, which is great as in terms of recognition or like gratitude towards healthcare professionals, but also they're human. We can't pretend that they're superheroes and that they don't break down and that they don't need rest. So I would say those are a few things that why this idea of caring more for healthcare professionals is overlooked. And just the other thing I want to add to that is in school, we don't necessarily teach these tools of like self-care or like the emotional toll that working in caregiving roles can have. And that's one of the things that motivate me to bring these tools not only to healthcare professionals, but also into faculty so that people can learn about these tools sooner to help them not only through the grueling school days, but also prepare them as they transition from a student to a practicing healthcare professional.
I think it's so important for everyone to learn how to take care of themselves because from a nervous system perspective, if we continue to override, yes, we fall into burnout or chronic or systemic inflammation, which is never good for anyone, can lead to so many different diseases. And so have you seen in your practice when you're working with the healthcare professionals, can you see their systems almost slow down, slowly integrate so that they can have more of this restful way of interacting with people, like more active listening skills, more embodiment tools, maybe?
Yeah. Yes. So no, definitely and as embodiment practices don't happen overnight, but you can see the gradual shift that occurs. And as you can imagine, I'm making general statement here, but like the healthcare system, like the work environment it's built on urgency. It's very go, put out fires, constant interruptions. So we're like really in that reactive mode of operating. And not all, but a lot of healthcare professionals that I know, like we're fast talking, we're like get to the point, we're just like very always rush, basically like the rushed woman syndrome or the rushed person syndrome.
Yeah.
That's how we are. And as you say, where it just puts us in this heightened mode, we're on high alert, high vigilance, because that's how we have to operate in this system. And obviously being in an act like having your sympathetic nervous system activated is not a bad thing. It's good to be alert, and there's amount of stress that we can handle, right? Being within our window of tolerance when we're looking at the nervous system. But obviously, as you said, if we're just constantly, it's overactive and we're not having time to downregulate, it's like an issue. So for sure, a lot of the tools that I would share with my healthcare professionals is learning how to downregulate. So yes, understanding nervous system, but also learn, okay, what are the tools to help downregulate the concrete things? What can you also do during your shifts? Because it's nice to have tools to, let's say, wait until you get home and to have maybe more of your beautiful space, but we need to also not wait until your 8-hour shift or 10-hour shift is over. So a lot of the things I teach them is what can you do right now in the little moment to help slow down. And even if, because when you're talking about slow down, I don't know if this is like a nuance that you see also, but when we talk about slowing down, sometimes people think like it's just being like super chill and talk more slowly, which is beautiful. But like in healthcare, what I see what could be really interesting is even if your actions aren't necessarily slowed down, they're like there's pauses, little small micro pauses. So what I tend to share, let's say with my pharmacist colleagues, is just even between patients or like a prescription, just take a moment to take a deep breath. Those little moments, right?
So good.
Yeah. Or like this right before seeing a patient, just again, taking that deep breath, or if you need to just go into the consultation room, just give yourself that hug and like this nervous system, like regulation to remind yourself that you're safe, especially let's say because when we're working with public, there's bound to be a difficult interaction that you're going to have. So like, how can you just bring your body back to safety? So even if you're still working at a very high pace, just inserting those like micro moments to doing like micro slowdowns. And that's what I tend to see more often in the beginning. And of course, then I would say maybe the second phase of that after is saying, okay, how can I put boundaries to maybe say, take on less workload and to create more space so that I'm not rushing everywhere during my day. But I would say like the first phase of the things that I would see is creating those micro moments in a still very full day.
I really appreciate that because it's what I teach as well. It's micro movements. It's not about getting onto your mat for 60 minutes and taking that yoga class. It's how can we find presence, pressure, touch in those moments to help us find safety, exactly like you said. How do we feel grounded in our body in a matter of a microsecond? And it's just drawing attention to ourselves and what we're doing and helping us with all these different tools that we have that our nervous system can react to. So I think that's incredible. What incredible tools that you're teaching.
Thank you. And maybe something I just want to add is one thing that I often like to share also with people, like when we're talking about like self-care. Yes, it could look like the 60-minute yoga mat at practice or the bowl baths, etc. But also for me, I always explain to people like self-care is any kind of practice or moment that this reminds you that you are worthy of your own care and attention. And for people who are in caregiving roles where we're focused a lot on giving outwards, caring for the person in front of us, it's also always coming back to the idea that you are also worthy of care and attention. And this would be like a total other tangent that we don't have to visit, but I'll just mention is sometimes there is external pressure to perform and to go fast. But sometimes what prevents us from slowing down is our own internal narrative that, oh, I can't take this time for myself. People are waiting for me, et cetera, et cetera. And just the idea that reminding ourselves that we are worthy of our own care and attention in this moment, even if that looks like taking that one deep breath, like we are worthy of taking that little time for ourselves.
I think that's so important. And it's funny because the phrase that came to mind is I always tell my clients, like, we're not saving lives, but in this case, they might be. So
I would say, even I was having this conversation with a pharmacy owner, and he's like, yes, we're doing important things, but like at the end of the day, we're not in the emergency room or ICU. I mean, if you're working in the emergency room or the ICU, like I would say you are probably saving more lives than we are. Like we're doing important stuff, whether it's like consulting patient, et cetera, but there's still a moment to like breathe and like pause.
Yeah. And I do believe that will only benefit the care and making sure that even the prescriptions are right or what you're putting into the bottles are. It's just important to take time to really be inside of yourself throughout the day as much as you can. I think that is really important. And the worth piece it's so important to understand that you're giving out all these things all day. You're taking care of people all day. Why can't you give yourself that same care and attention? I think that is an important point. You just went to a conference called, I believe you spoke at it.
Yeah, I did speak at it, and maybe again to give context to your listeners. So it was organized for pharmacists with two intentions really. The first was to update the pharmacist on the most recent recommendations and guidelines to treat and manage different conditions, health conditions related to women. So menopause, perimenopause, but also cardiovascular disease, which actually evolve and appear differently for women and different conditions like this. But the second intention, which I found really interesting, and this is where I was invited to collaborate on, was really raising awareness on the medical gaslighting that occurs most often in women, but also the iniquity when it comes to research. So less research is done on women's health. When we're looking even in research, less women are enrolled. Anyways, it's like a whole thing to unpack there. But that was like the intention, to really raise awareness and bring that more human aspect to like remind people that yes, we're sharing about recommendations and guidelines, but always remember there's a human being that we are serving, where we're thinking about these, where we're looking at these conferences. So my role in this, because I practice as a health coach for women for 6 years, I got to really be exposed to a lot of different stories of women navigating the healthcare system, both positive experience, but also negative and heartbreaking experience where their symptoms were dismissed. They were said things that really inappropriate things and essentially were gaslit when they consulted. So that during my practice, I got really, to be honest, I think that was really when I was more aware of it. Because when I was in school or even practicing in hospitals, like it's not something that I heard a lot about. It's more something that I learned when I was a health coach. And because of my experience helping different women and also the online community that I built, I was able to reach out to these women, and Stella connected us too, which I'm really grateful for, and was able to collect 11 stories from different women and created a 51-page booklet, all sharing their stories of what their experience was navigating the healthcare system as a woman. And I was able to bring not only these stories to the conference, but also create like an exhibition that people can walk through and like really start reading the stories. And the feedback that I got was, it was such incredible feedback, and really people really appreciated that like human touch that we brought to the conference, but also allowed, it helped people share like the work that they were also doing in the field. And it's really fun because it makes me very hopeful for the future of healthcare and the future of how women will be treated, because there's amazing people who are doing great things to help elevate the kind of care that we're offering to women. So I'm really happy I got to participate in the Seme Santé de la Femme. I love that there's initiatives like this focused on healthcare professionals to raise awareness around this topic that, again, like I said, like in school and in my own day-to-day practice, I wasn't so exposed to.
It sounds so impactful to have that human connection and that human touch of walking through people's stories, seeing and listening and hearing about what different women go through. I think this is a tangent, but I recently listened to The Diary of a CEO, the podcast, and he brought on these 4 doctors, OBGYNs, and finally doctors said out loud the whiny woman syndrome.
Mm.
And so it confirmed, it was like a confirmation, a feeling of, okay, it's not in our heads. Like we present to doctors or we present to OBGYNs and maybe they should have also this health coaching aspect to really be inside of their body and be more embodied, to be able to listen and really care for these people or these women that are going in front of them. Because to hear that, there was a moment of, like it feels good to finally just know that this is true and it doesn't exist just in my mind and my body, but also like how sad that this does exist in the world and in the medical field, and how women have been gaslit for so long. And so having something like this where women or just people in the field to walk around and exhibit where they see the people's stories, and it's not just doctors telling, oh yeah, this is what we did and this is what we called and we're sorry about it, but we're going to move on now, we're going to try to be better. This is actually humans that have been deeply impacted by a system is currently sick and needs to have some change, needs to have some health coaching and help them to slow down as well, and to realize that is not a weakness, but it is also a superpower in itself.
Agreed.
Yeah. So going through this, speaking at this conference and sharing what you did, which is thank you so much for doing this. Did it affirm anything for you about the direction of the healthcare system, like where it's going?
As I mentioned, it gave me hope of that the care that will be provided to women will continue to improve, and maybe not at the rate that I would hope to, because I'm like, I want to see a change right away tomorrow.
Yeah.
But it does make me hopeful because I feel like more and more, like both in the medical fields, in the healthcare field, but also as a population, women are waking up and they are demanding for something else. They are demanding better care. They're no longer tolerating status quo and being kept in the dark about their bodies and their health. So I feel like there is a beautiful movement that is happening. And as you said, it's terrible. It's sad that this is happening. And also, I'm hopeful about the change that is occurring because people want to see the change. And there are also then people who actually are creating the change. There are different associations which are like tackling this issue, but also, as I mentioned, like tackling issues that are less researched on, like I mentioned, for women's heart health. So women, like the number one cause of women's deaths is actually cardiovascular disease. And at the same time, it's underfunded and the research is lacking. But there are more and more clinics that are being created just for women around heart disease and heart health, which I find is an amazing initiative because, again, this is the number one killer of women. And we need to have the proper tools, not only manage, but also to treat, to educate, and prevent this from occurring. So I'm really hopeful of about the direction that we're heading.
Yeah, I think the more it comes out of the ground and into living space, I think it starts to become impossible to ignore. So it starts to have to create change. And I'm grateful for these doctors in the medical field that is putting it into research and making sure that these fields that have been understudied for a long time are actually taking women into account. It's very important. I want to talk about your Replenish RX program for healthcare practitioners and understand how it does transform the way practitioners relate to themselves and their work. Can we talk a little bit more about that?
Yes, we can. Thank you for asking. Replenish RX is like my little baby, but like in more concrete terms, it's online resilience course for healthcare professional. And what makes it different, or like how I wanted to make it different than the typical corporate stress management course, was to one, yes, combine like evidence-based tools, but also with a mind, body, and heart approach. Because this is also how I've always practiced my own health coaching practice, is with that holistic whole person view. And I think you mentioned this earlier, healthcare practitioners tend to be very analytical, very in their minds. So of course I incorporated like a mindset part to the course because one, it's important. Also two, I think this is like a topic that I introduced first because I feel like this is what will resonate or that they can understand easily because we're very head people. But as we're not this walking heads, we have a body, we have a heart, we have a soul. So I also incorporate these elements, but also because we're talking to healthcare professionals, it's a very evidence-based approach too. So when I talk about the body, we're talking about building body awareness because as not only healthcare professionals, but like high achieving people, they tend to be disconnected to their bodies and just helping them learn to read their own signals. And this is something that a term that I use a lot in my health coaching practice when I was working one-on-one is creating a partnership with our body. So it's hard to be able to listen to it, but also want to be able to treat it well, to work with your body as an ally, and also the whole nervous system regulation aspect of it. And then we move into the heart aspect, which is about self-compassion, because a lot of high achieving people tend to be their worst critics. They tend to have very high standards from themselves, but sometimes it works out against them. And this is one of they contribute, the contributors to the stress that we face as healthcare professionals. And also I talk about the idea of value-based living. And what all these aspects combine together, the mindset part, the body and the heart, is yes, it is giving healthcare professionals tools to not only navigate the demands of their life and their work, but more confidence, calm, and ease, but also tools to help them cultivate joy and a meaningful life. Because life is more than just managing by or like managing stress. It's also about creating the life that feels meaningful to them. And so that's the idea of the course. It's like an 8-week course. And I'm really excited to share these tools with healthcare professionals because I've seen the one of the things that I hear often is, yeah, I move through my days with just so much more inner peace. It sounds very fluffy, but I think when you can feel that sense of like ease and calm, and even and the often like even if my outside circumstances haven't changed that much, like I'm moving through my own life and my world in a different way. And that just feels very, again, it gives me that same sense of fulfillment and reward of being able to help people, yeah, just relate to their world in that different way.
I love that. And I love the aspect of joy, of remembering to bring in joy, because sometimes when we talk about the nervous system, we help give tools to bring in that grounded feeling, that inner sense of, okay, I'm inside of my body. And so sometimes we can get involved in making sure that we're present. And then we take the same tenacity of, okay, I'm going to be great in my work. I'm going to be doing good in this. And then we bring it into this like self-awareness practice. We're like, okay, I think we missed a little bit of the point of being soft with ourselves. And so I find that joy piece is so important because it's like sparking that plug to be like anyone could go out for a walk, right? And if we're in our sympathetic system, we feel that when we're marching. If you're aware of your system and you're walking down the street and you're in this full march and you don't notice anything because you're in your lane, you're staying in your own lane. And when you spark that joy, all of a sudden you just slow down. You look around, you're looking at the colors of the trees, the different leaves, the way that your feet make sounds on the ground. And you're like, oh, this is bringing in all these different sensations. And it sparks joy in the body. There's a moment of saying, oh, yeah, I've arrived. Like I'm already inside. And I think that's really important.
Yeah, thank you for sharing that and that little nuance. And for me, what I said earlier is them, and not to shade on like the corporate stress management initiatives, which I feel like they're important. And also, I feel sometimes the focus is a little bit like the idea of managing stress, which I feel is very tied to the idea of even in healthcare, like treating the symptom, treating an illness, you're managing something, but anyways, I would like to move beyond the idea of managing by, the idea of surviving. So we want to flourish, we want to thrive, we want to be enjoying our lives. Like we're not going to spend the rest, like just our time trying to manage these problems. There's also so much beauty, and we can hold both the stress, the challenges, and also see like the beauty. So that's one of the things that I aim to do with, yeah, my course.
Yeah, agreed. I think it's amazing to not just go into how to manage, but also to take care, to flourish, to thrive in your own way. Because and this goes into my next question, it's also if you're constantly stressed and if you're just managing your stress, when you slow down, when you retire, for example, what happens, right? What happens in the body? So when service becomes overextended, like how can we help how can you help artists? How can you help the healthcare practitioners to see, okay, you're getting to that edge. Let's start to pull back because if we keep this up, if you continue this till you retire, it's not going to go so well. So let's manage it before, or not manage, but let's take care of it so that we don't have to manage it. We can really live and enjoy life.
Yeah. So I think the first thing I want to say here is that piece about awareness. So there are always signs, right, that tell you that you are headed in a direction of exhausting and burning yourself out. And if we try to break that down, is the idea of like building body awareness, awareness of your emotions, and also awareness of your thoughts. So the body awareness piece, which I teach in the body section of the course, is okay, what are the signs that tell you that you are getting exhausted? Is that the shoulders creep up, that things are clenched? For me, like I have my eye twitches. And as soon as like I get that like twitchy eye, I'm like, okay, like I'm forced to slow down because if not, this is not going to end well for me. So it's like just recognizing and not only recognizing, but actually acting on it. So saying, okay, let me slow down, do something about it. The feelings, it's the ability to say, well, I'm really cranky, I'm really, or like whatever kind of feeling anxious, etc. And the thoughts is understanding that, hey, maybe lately I've been having really anxious thoughts, negative thoughts, even dark thoughts. I've heard people share stories about like a little fleeting moment of thinking about ending their life, even if you don't have a plan, just like that thought. And they're like, whoa, I can't believe I've had that thought. Let me try to look at what's going on. And it's great that they were able to have that wake up call. But I would also hope that we could start recognizing our thoughts and what is going through our heads before we end up to that spot where we're, just having a, even if it's not a intentional or serious, like, but we were going to act out on it, thought about ending our lives in some way. So I think that, yeah, that ability to build awareness, whether it's by yourself or with the help of a professional, so that whether that's a coach, therapist, etc. I think the first step is to build awareness, because once you're aware of something's going on, then you can actually take care of it.
Like awareness is the key that opens the door to everything, and you can't stop it once it's opened. You have to acknowledge it and take care of it. And it's amazing that if they do become aware of it, they also have someone to speak about it with and to share, because sometimes without that, it can also get really tricky. So thank you for being that person for them and to them. I think that is really important. The pharmacy world is very lucky to have someone like you in it that's helping them to navigate their own nervous systems to feel safe and resourced inside of themselves. I want to talk a little bit more about get a little bit more personal, if that's okay.
Yes.
You said last year, as you were trailblazing this path for yourself, 2024 was your year of firsts. What has it taught you about evolving and leading through uncertainty?
Yeah. So when I was talking about the year first for your listeners, it's like on my podcast, I shared, I was just trying a bunch of like new things, getting outside my comfort zone. And I feel like what it has taught me in terms of evolving or being through uncertainty, I guess there's like a few things I want to share. First is that idea of self-trust and having my own back, trying out new things. There is bound to have things that are going to feel or not work out as the way I planned. And while I can't, let's say, guarantee the outcomes, I can always decide how I'm going to treat myself in these moments of disappointment or yeah, just being maybe even disappointed about certain outcome. Like I can treat myself. I can take care of myself versus maybe how my younger self would have acted is like criticizing myself. So that's the idea of building self-trust and having my own back, is making sure that no matter what happens, because I can't guarantee what's going to happen, I can take care of myself. And I feel that having that kind of relationship with myself is something I'm very proud of having built, and what has also allowed me to navigate the ups and downs of entrepreneurship, which can be quite gruesome. But being my best ally, I feel like is definitely helps me navigate that. Another point I would say in that is like this deepening my trust in the universe and in life. And I personally have a spiritual practice, and my belief is that things happen for me. And while also, of course, I do want to validate if something happens and I'm really, again, disappointed or feel embarrassed or shame, etc., to validate those feelings, but to also know that on the other side of this, there's something even better. And it's not always easy. I'm not going to say it's like a walk in the park, but it is something that I've been leaning on and trusting that there is something better. And there's going to be also a lesson to learn from all of this if it didn't pan out how I wanted to. And also there's something good waiting for me on the other side. And I guess the last thing I would want to say about this in terms of things that has taught me or just reminded me is, for me, like, when it's your first time doing anything, things can seem either like scary because of the unknown. But I feel like what's even scarier for me is the idea of wondering what if, that regret. For me, like that is something that some people think it's morbid to think about like being on your deathbed. But like for me, it's thinking about my death, being like what it's going to be like on my deathbed. This helps me remind me to be intentional and to listen to my heart, listen to my values and what's important to me. And for me, it's more important to have tried and to have given myself a chance versus regretting and wondering, oh, what if I had would have done that? What would my life be?
Mhm. It sounds like you have a very healthy nervous system.
Thank you. I'm very proud of the care I've been giving to my nervous system. Yeah.
Yeah,
It's
it sounds like with the awareness of yourself and learning all about yourself, that self-trust comes in. And so it's with you no matter what you do. If it's new or if it's something that you're going to try and make sure that you do it before you die, that you've done it. And that's such a beautiful, it's such a beautiful ode to taking care of your nervous system, to building that trust and not saying, why is this happening to me, but saying, how is this for me? I think that's such a beautiful reframe. And so we learn from it, but we also don't prevent ourselves from moving forward. I think it's really beautiful.
And I actually just want to add a little something here because we're talking about being on our I'm talking about being on my deathbed. But I feel like being as a healthcare professional and just helping people through illness, sickness, but also helping people who actually were like in palliative care, terminally ill, has given me the gift of not taking life for granted. And do I live like every single second of my life thinking about, let me live the life as if I would die tomorrow? No, I don't. But like it does give me perspective and like regular check-ins with myself to be like, life is short. I never know when my ending is going to come. Knock on wood, it'll be in many years from now, but I can't guarantee that. So let me just make sure that I'm in this moment happy with how I'm living my life. So yeah, that's a little thing I just wanted to add there.
Yeah, I love that approach. And I think that's incredible. And it could set me on a tangent of why we separate death from the living and all these things, because I think that's such a healthy way of seeing life, right? If we understand death, then we don't have to fear it, but we also live to live and not, yeah, the other way around. But I feel like that is something really, really beautiful to be aware of, and that your life led you in that path to have that experience so that you can live a life. I'm not going to say I like worth living, but without the big brackets around it, just like the life that you want to live. Cool. Okay. So we spoke about the year 2024 being your first. And so in your podcast, you also talk about the year 2025 and how it was the year of refinement. Can you share any insight into what refinement feels like for you almost at the end of the year?
Yeah. So, well, to be honest, I don't remember 100% what I said in that podcast. But when I'm thinking about refinement now, today, it's the idea of really choosing what feels aligned and also giving myself the chance to become excellent at something or to improve my self mastery of something. So what occurred also in this year was the year I closed my fulfilling and successful one-on-one health coaching practice because I wanted to give myself the chance to see this project through with healthcare professionals, Replenish RX, and to also really become an expert at this new path that I'm in. Health coaching, I've done it for 6 years. And of course, there's always room for improvement, room for new skills, new knowledge. But I wanted to now focus my time on this and hone my skills and create another new thing that I could be super proud of. So in the idea of refinement, if I were just to break down what I just shared there, is that idea of saying no, what either no longer feels aligned, or in my case, it's not because it didn't no longer feel aligned. It's because I was looking for a new growth opportunity and an opportunity also to become another version of myself. So being able to say no to who I was and also to, make the little adjustments to see, okay, in my mind, who is that version that I want to be and to do what I need to do. And also to maybe focus on more like one thing versus being scattered and trying to be good at several little things versus maybe more being excelling at a craft, like a single craft. So I feel like that is what I can share about this idea of a year of refinement for me, making some tough decisions or closing something that I love, my practice. And yeah, just again, giving myself the chance to see where this could lead me again, because of the idea of I don't want to be in the what ifs. One of the things that led me to making that decision is, yeah, I just don't want to arrive in 2, 3 years and say, what if I really gave this project the chance and the time and attention it deserved to really grow and to help the people that I could help by focusing my energy.
It sounds like refinement is becoming clarity, like really being clear on where you want to go and what you want to do and who you want to impact and how that impact moves into different streams.
Yes, that was beautifully summarized. Those are the words I should have said, but you summarized it beautifully. So thank you.
That's because my nervous system is really relaxed.
I love it. We're like, it's like chilling here, super calm nervous system together. It's a good sign.
Yeah, it's really working. Okay, so if 2024 was the year first and 2025 was the year of refinement, what do you believe 2026 to be?
That's a good question. I'm so happy you asked that because it gave me the chance to like just think about that because I haven't done my like year-end review yet. But the words that have been coming back in my coaching calls with my coach is play.
I love
And
that.
I think 2026 is going to be a year of play because while service and impact are genuinely core values of mine, I recognize that I've been putting too much emphasis on them, putting really am at the forefront for, I would say, almost since I launched my coaching business. So that's 6 years. And I'm very happy about the decisions I made. And also, I am ready to bring more space to play, nourishment, and to yeah, a little taking care more of me because I'm not at a point where I'm at like burnout. And because thankfully I use my own tools and I know like where I know how to adjust my workload depending on where my nervous system's at, my body's at. But at the same time, I recognize that I don't want to call them sacrifices, but I made certain choices to grow my business. And now I'm like, my little inner child's okay, Julie, chill. We want to play, we want to have fun. And I know obviously that will also help us refill my cup and to allow me to be continue to be of service.
I think play is such an important component. It's if we have to go to work every day and every day is the same day, like Groundhog Day, it's like at what point do we say, okay, how about we take a break and play a little bit or just enjoy what we've worked so hard for? You never take time.
But interesting, play doesn't feel so safe. It's not as it doesn't feel safe for a nervous system, but like long extended periods of play, my nervous system's okay, this is getting uncomfortable. I'm going back to life working. I'm like, okay, there's refinement there to do of helping calm my nervous system and being okay with taking a prolonged, spacious time to do whatever I want to do.
Hopefully the self-trust is growing and you can dip your toe and then sink your leg in, then your body, and then release the mind completely to enjoy prolonged play because it is important if you work. And this comes down to values and what you give priority to. But I think it's like that joy, right? That spark of joy. It's that if you just keep sparking it, but you don't let it fill the air for a bit, then that's all it is. It's a glimmer, but it's not really going to sustain a beautiful, slow burning fire.
Yeah.
Okay, my last question, and you spoke a little bit about it, like your inner child is coming up and is excited. What would you tell your younger self about success, rest, play, and self-worth?
Perhaps to answer first, the idea of success is to celebrate myself, my moments of success before I wait for the outside world to do it. To validate myself, to allow myself to feel proud, truly like in an embodied way. So if I can just share a quick story is last year I gave a talk and that was one of my first like more public speaking talks in front of a big audience. And I was literally proud for 5 minutes before the inner critic started being like, oh, you should have done this. Oh my God, you didn't. And anyways, just finding all the list of things I should have done differently. And that was this like such a party pooper experience. And this year, when I gave again a talk to that same association and at the same time, around same time of the year, I really allowed myself after I got off on stage to really just feel proud and to be like, oh, I'm so happy I've done this. And just to like somatically feel it. And whenever the little inner critic started coming, I'm like, okay, I'll listen to you tomorrow. But like tomorrow, today, we are just like enjoying ourselves. And I remember even just walking back at home, I still had a grin on my face. And it just felt so nice to offer myself that as somebody who is very high achieving, has very high standards for myself, just allowing myself to be like, yeah, Julie, you did a great job. And of course, like external validation is nice. I did get great feedback on the talk that I gave, but the fact that I validated myself first, and I also allowed myself to feel it and to soak in it. I feel like it was such a beautiful gift I gave myself. So this is something that I would share with my younger self. That like allow yourself to feel proud, bask in it, and yeah, that's one thing I would say to her. And in terms of the idea of rest or play, I mentioned it a little bit earlier, but like the idea of that impact and service, yes, they're core values of mine, but also don't let them take up the full space. Allow yourself that idea of play. And for me, the idea of play is just being able to do whatever I want, a lot of spaciousness, no, without shooting myself. And this is a joke I tell my friends, but like I'm quite serious about it. Is my idea is like having a playful day is just not contributing to society in any way.
Sorry, what does that mean?
Because I'm someone again who like so for me to feel like enjoyment, like I feel like I have to be useful to somebody, be of service. And there might be part of like shadowy parts of that because thinking, okay, I'm only good worthy if I'm useful. There's maybe some shadowy parts, but I think there's also like a genuine part of like it just fills me up to be of service, to want to help someone in any capacity. But like the idea of just being able to do whatever I want to do without having to be of service or like doing something for others. That's what I mean. So that could just be, it could be as simple as just reading a book just for my own enjoyment or being out in nature to resource myself, but not having to get impactful for someone else. That's what I meant, but not contributing to society in any way. I just want to, yeah, just veg and being on my own. And yeah.
I think that's so important. Just it is part of our nervous system response biologically. Women have it's not different from men. Men do feel it too, but part of our nervous system is also tend and befriend, which means that we reach out, we connect, we feel better when we nurture. And so if we don't learn that about our physiology, sometimes we overextend because it just makes us feel good. Oxytocin is like coursing our bodies. And so it is so important. I've never heard it that way. That doesn't impact society. But
I'm not contributing. I'm not
contributing
anything anyway right now.
Anyway, it makes sense because of the job that you do and probably with your family and your friends. But I do love that. And I think it should be a quote that you
But take it out of context, it just sounds so weird.
But I think it is important to self-nurture and to do things that it's just for you. And you don't have to talk about it. You don't have to declare it. This is just, it's you time, whatever you decide. And it doesn't have to contribute to anything else. Thank you so much for sharing it all. What an incredible conversation. And I'm so grateful that you took the time to have it with me and with my listeners. So thank you so much, Julie.
Thank you, Natalie. It was such a pleasure.